President Yoweri Museveni wants Kiruddu and Kawempe National Referral Hospitals reinstated to general status, and this is the argument he fronted while at Kololo last week.
Kubanga bwefuuka district hospital, bwefuuka referral, ate aba district bagenda wa.
But if you wonder why the president is taking this stance, here is his reason.
Amalwaliro ago gaali gakuyamba mulago. Togenda mulago, tandikira wano, endwadde ezisinga obungi zigwere wano.
However, we put President Museveni's thoughts to the president of the Uganda Medical Association, Dr. Herbert Luswata, to have a better understanding of the argument.
Actually, the majority of the Ugandans who come to these hospitals, they don't even know these things, that this is a referral hospital. Because you'll go to Kiruddu and you'll be surprised, someone who gets malaria and feels shiverish and headache, they will come to Kiruddu. Because for them, they don't know those things, that this is a referral hospital. They have come to hospital and they need treatment.
So what happens if we strip them of their referral status?
When you look at the funding, a district hospital gets less money. The funding for a national referral hospital is huge. So if the president is looking at improving services in the regions where these hospitals are located, then he needs to find out what are the real issues or the real reasons why probably these facilities are not performing to his expectations, like the equipment to do investigations and have early diagnosis for the patients. I think the budget for the drugs in these two hospitals also needs to be improved, so that when the patient comes, we see them, we use the equipment available to diagnose their diseases. They are also able to go back home with the medicines.
But President Museveni promises to build 2 more facilities at the level of Kiruddu and Kawempe hospitals within Kampala.
Era twalina kuzimba eddwaliro eddala Rubaga lya gavumenti, eddwaliro eddala Kampala Central ne Nakawa, era tugenda gazimba amalwaliro ago.
Professor Francis Omaswa, who was once in charge of health services as Director General at the Ministry of Health, however, concurs with the president that the 2 hospitals could be duplicating work meant to be done at Mulago National Specialized Hospital since its renovation was completed.
But the main point is that a general hospital is better than a referral hospital for the community around. It should provide all the full range of basic services for the population. And if Kiruddu and Kawempe revert to being general hospitals and not referral hospitals, that is good news for the community around there.
He says the issues related to budget and staffing can be realigned later. The 2023-24 ministerial policy statement shows that Kiruddu Referral Hospital admitted 7,912 patients, conducted 1,037 major surgeries, 8,423 dialysis sessions, 25,755 specialist outpatient department attendances. Whereas Kawempe Referral Hospital conducted 10,749 deliveries, 4,589 were by cesarean section, 2,231 gynecology emergency admissions, 1,468 pediatric ward admissions, and 3,943 NICU ward admissions. The hospital attended to 47,159 outpatients, 15,340 antenatal attendances, and immunized 17,702 children. Only time can tell whether the decision to strip the 2 facilities of their referral status will be for the good or could actually be detrimental. Walter Mwesigye, NTV.